if you're over the age of 60, these are 3 ways that the medical industrial complex potentially increases your risk of dementia. Yes, I just said that. Potentially increases your risk of dementia. Am I saying that the medical profession and doctors are bad and they deliberately set out to cause negative outcomes? Absolutely not. Everybody knows there are good, hardworking doctors out there. But sadly, the way that things are set up now, the medical profession, most of the time anyway, will mindlessly do whatever their physician societies and authorities tell them to do, with little critical thinking or asking the right questions. And we all know the truth. Many of these societies and organizations are loaded up with conflicts of interest. And the people at the top, the doctors, for want of a better word, as we say in the United Kingdom, I don't think their heads are screwed on correctly. They are so bought into the big pharma paradigm, and actually maybe their heads are screwed on correctly. Maybe they have other reasons for doing what they're doing. But I have enormous concerns, as I know a lot of good doctors do, about overtreatment and this philosophy of being hyper aggressive with certain treatments. And I'm going to outline to you, this is especially important for you or a loved one if you're over the age of 60 years old. Certain things to think about. And of course, it always goes without saying, never stop or change any medication yourself. Always speak to, hopefully you have a trusted doctor, but it's so important to be informed. So number 1, over-treatment of blood pressure. The classic scenario goes something like this. Somebody will be put on blood pressure pills in their 40s or 50s, and these will pile up over the years. So by the time somebody reaches, say, 65, they might be on 2 or 3 blood pressure pills. But natural changes occur in the body above a certain age. And in a lot of people, the blood pressure can start to drop. And even away from the blood pressure dropping, it can also be normal at the extremes of age for a higher blood pressure. I made lots of videos on that before. Important for blood perfusion to the brain. This is basic common sense, but a scenario I see over and over again is somebody over the age of 60, 65. They're on 2, 3, 4 blood pressure pills, and they'll be running at a low blood pressure. It's quite clear that when you talk to them, they've got symptoms of dizziness, weakness, and when you check the blood pressure in the office or the hospital, the systolic number, the top number, might be in the low 100s, so 102, 103, and it's quite clear that they're being over-treated for blood pressure, and this manifests even more when anybody starts to get sick. It's terrible. I believe millions of people above a certain age are being over-treated for blood pressure. Number 2, over-treatment of cholesterol.